What if you could regrow cartilage, like not in a petri dish, but actually in your body? And it was shown in scientific studies to yield that incredible result. Well, that's what we're going to be talking about today. Oh, by the way, without pharma, I love a good pharma when I need it, but on a daily basis, I like to do things naturally and have support from all kinds of sources. I'm Shivan Sarna, and I created this platform called Chronic Condition Rescue. It's because I had a ton of stuff wrong with me, and I'm doing great now. But I worked in a moldy building. I was a mold denier, and I also had food poisoning at 5, and I had SIBO for decades. And now I help other people figure out what's up with them and connect them with the right people. So, speaking of right people, Kiran Krishnan is my very special guest today. Kiran is the co-founder of Microbiome Labs. He has also gone off on other adventures now and is bringing really innovative, very special products to market. So I'm talking about like you're not here for a second. So he educates more people that I can think of than any other one individual that I can think of in this functional health space. So literally, how many weekends a month or year do you travel, Kiran?
So I mean, I go to like 55, 60 conferences a year. So we're probably talking about almost one a week.
Wow.
Which is kind of crazy. I actually did a rough calculation for another program I was doing. I think I've spoken to, and this is just counting on stage, or in master classes and things like that, about roughly 500,000 practitioners in the last 10 years.
Wow, that's phenomenal.
It's a lot.
It's a lot.
Yeah.
Thank you. So this is why I'm so honored to have him here and honored to have you all here. He's been with us every month for years, and I'm so glad to be able to share this newest development. So it's called Cartigenix, and it is called Calroy, is the mother of the company. And this is the newest supplement that he's been creating. We are going to talk about your cartilage and your bone health. And I'm going to hand things over to my microbiologist and microbiologist friend, Kiran Krishnan, to educate us about this. And I got a coupon. I'll throw it in the chat later on. Thank you, Kiran. How are you?
I'm great. I'm so excited to talk about this. So this became a real deep passion area because, working on the gut for more than the last decade or so, everything comes down to inflammation. There's a lot of issues that inflammation drives within the body. And of course, inflammation perpetuates gut dysfunction and the issues with the lining of the gut. But then the lining of the gut being dysfunctional also drives massive amounts of chronic low-grade inflammation, right? So it's a self-perpetuating problem that occurs. And then as I dig further into inflammation and I do lectures on what happens when you have a certain type of inflammatory milieu, areas of the joint really become very relevant here. And it's more than just trying to rescue what's happening in people's joints. There's a bigger picture to it. And I'll make a couple of claims that hopefully we will validate as we go through the talk.
Okay.
Number one is that joint health is a really critical precursor or need towards a good health span, right? You cannot have a strong health span without good joint health. And there's a few different reasons for that, which we'll elaborate on. Number two is that joint health is a canary in the coal mine for similar degenerative processes that are going on in other parts of the body. Right? You just feel it in your joints, that you have a higher likelihood of feeling it in your joints before it becomes really bad than in other parts of the body, right? And the reason why the issue around joint health can be a canary in the coal mine is because what's happening is we're battling this anabolic catabolic balance, right? What does that mean? Well, the anabolic processes in your body are the processes of rebuilding. So repairing and rebuilding, right? So that's anabolic. Catabolic is the process of degeneration, and your body has both. And aging is really well defined as an acceleration of the catabolic process.
How are you spelling that, Kiran? Are you saying like catabolic?
No, catabolic, like
C-A-T. Okay.
Catabolic.
Okay.
And the rebuilding is anabolic.
Got it.
ANA, BOLIC. So aging is very well described as a battle between these two processes, right? So you've got, when you're younger, the reason why you can recover from things so fast and you've got boundless energy and all that, because your anabolic process is higher than your catabolic process, right? So when you damage things, the anabolic process goes, all right, no problem, I can repair this, and fixes everything. All your cells are working at optimum level. They all have the right amount of mitochondria. They're producing all the energy that you need. As you age, this starts to shift. And if you get to a point where the catabolic processes are starting to win, then you're going to have a net degeneration in your body, right? And that's the same thing that happens in your joints that you start to feel, because your meniscus tears away, it becomes too thin, and then your cartilage goes away. And before you know it, when you put weight, you've got bone on bone. It becomes really hard and devastating. It's a terrible quality of life, but it leads to more profound issues, right? Which we'll cover in all of it. So this is the premise under which we're talking. Couple of claims for people to think about. So let me...
And it's not medical information for your own personal case or anything. Obviously, I'm going to hide my camera and my audio while you go for it. All right.
Yes, that sounds good.
Thank you.
Let me start the slideshow here. Okay. All right. And you can see the full screen, Shivan?
I can, yes.
Okay, perfect. All right. So in parts of the talk, we'll be linking gut health to joint health, right? But just keep in mind, we're really also, not only are we talking about how your joints feel, how they'll function and all that, and where the gut plays into it, but there's a bigger picture message here that I'll keep reiterating that I want you to try to capture, right? And that is on this issue of degeneration and what drives degeneration in the body, and how the joints are a canary in the coal mine, or if you will, a lens into degenerative processes in the body, right? These are my disclosures. As Shivan mentioned, co-founder of Microbiome Labs, a couple other companies as well, EndoAxis, Civ, Phytoveda, and so on. And I do consult with Calroy and have partnered with them and a couple other companies. And I sit on a number of scientific and other advisory boards as well. And really, where the rubber really hits the road, and when it comes to the gut issue that can drive issues around the joints, it's intestinal permeability, right? Because leaky gut or intestinal permeability leads to systemic inflammation. And that's part of the reason why individuals with GI problems are found to be 2 times more likely to have osteoarthritis, right? And that's not a mystery anymore when we understand the pathophysiology. And I'll elucidate that or make that really clear for you. And osteoarthritis is a massive and growing problem, right? So by 2040, it's estimated that the prevalence will grow to 78.4 million adults, Americans. That is, adults with arthritis attributable activity limitations will increase to 52%. Right now, where it is, not right now, but as of 2024, it's around 40 or 50 million Americans. So it's going to grow to 78 million Americans that have diagnosis with arthritis. And right now, arthritis attributable activity limitation is in the 30% range. It's going to go up all the way to 52%, right? That's very significant. And then there's significant overlaps with other really important chronic conditions like rheumatoid arthritis. Individuals have 2 times higher likelihood of developing cardiovascular disease. Osteoarthritis patients have a 55% increase in CVD compared to non-osteoarthritis patients, and 67.5% of osteoarthritis patients have hypertension, right? So there's all of these overlaps. So think about people with GI issues, right? And how that increases the risk of osteoarthritis. And then people with osteoarthritis have an increased risk of cardiovascular disease. Rheumatoid arthritis, significant increased risk of cardiovascular disease. Osteoarthritis patients have hypertension. Like, it all kind of goes hand in hand, right? The circulatory system, inflammation, catabolic processes, and all that. So the thing is, you might just feel it in the joint before you feel it anywhere else, because a joint also has to bear load, right? So as it's bearing load, it degenerates faster, but the biochemical process of degeneration is happening there. So let me explain what's actually happening, and let me see if I can if I have a tool here to make some marks so that it becomes easier to understand. Okay, so on this side, you've got what looks like a dysfunctional joint. Over here, you've got a healthy joint, right? So there's a couple of things I want you to pay attention to. So this synovitis, so this is the synovium. This is the liquid in the joint, right? So in the joint space, you've got this lubricant, if you will, that is called the synovial fluid, and it's in this space, this open space called a synovium. As you can see in the degenerative joint, it's called synovitis, which means that there's all this inflammation inside the joint, inside the space, the synovium space, right? Then you've got articular cartilage, which is an important part. So that's the cartilage that's sitting on this bone. This bone that attaches the cartilage is called a subchondral bone, right? The subchondral bone, then you've got cartilage, you've got the meniscus in there above the cartilage, and then you've got the synovium, the space in between, and then you've got the rest of the bone and further cartilage and so on. So that makes up the joint space, right? So what tends to happen here is that over time, as inflammation in the body increases, you start to get a concentration of inflammation in areas where there's a lot of stress. And one of the areas where there's a lot of stress is the joints, especially the load-bearing joints, right? So these are the areas that you carry a lot of the body weight. So you'll feel it in the knees, the hips, and other areas as well. If you do a lot of things with your hands, you might start feeling it in your hands and fingers. But anywhere where there's load-bearing or repetitive use, then inflammation accumulates in there, especially if you have a high degree of chronic low-grade inflammation in the body to begin with. Right now, that inflammation will start to create a number of pathologies. So number one, the subchondral bone here is the main blood supply to this cartilage and the meniscus and the synovium, right? So cartilage doesn't have its own direct vessels. It doesn't have direct blood supply, neither does the synovium, the space in here, right? It requires blood supply from small little micro vessels that are in the subchondral bone that diffuse blood into the space, right? So we're counting on the health of the tiny little micro vessels that are lined on top of this bone, and then we're counting on diffusion of blood from across the lining of those little tiny blood vessels into this space, into the joint space, and then those same vessels picking up the fluid from the joint space and taking it throughout the body, back to the heart, back to the lungs, and so on, right? And so keep in mind that circulation for this space requires diffusion from the vessels that are in the subchondral bone. So one of the first things that occurs when you start having chronic low-grade inflammation is the integrity of the vessels start to fall apart, right? So the integrity of the vessels are made up of the smooth muscle cells that are inside the vessels. So if you have a lot of inflammation, the smooth muscle cells start to lose their compliance or their functionality. So these tiny little microvessels start to collapse. And as they collapse, they can't hold blood very well. And as a result, this area doesn't get as much blood supply. Now, part of the downside of that area not getting enough blood supply is the bone doesn't get the nutrients that it needs in order to continue maintaining and rebuilding, right? So not only does the bone then not get the calcium, the magnesium, the vitamin K, and all the things that it needs, on top of that, the accumulating inflammation in that area switches bone-building cells, osteoblastic cells, into bone-degrading cells, which are called osteoclastic cells. So now you start losing integrity of this subchondral bone. Then that whole process diffuses to the cartilage here as well. And there are these cells called chondrocytes. These chondrocytes are critically important for rebuilding cartilage, right? So chondrocytes and osteoblasts are anabolic cells, right? So chondrocytes are anabolic cells of cartilage. They build cartilage. They take protein and collagen and things, and they lay down this beautiful cartilage. And then when the cartilage gets damaged over years of use, it repairs the cartilage and it regenerates and maintains that whole structure. So that's the anabolic cell, the chondrocyte. In the bone, it's the osteoblastic cells, which are the anabolic cells of the bone, which repair and rebuild the bone, right? Now, both those types of cells, when they have a lot of inflammatory cytokines around them, these are inflammatory mediators, they switch from becoming anabolic, which is the building version, into catabolic versions of those same cells. They now, instead of building bone and building cartilage, they actually degenerate bone and they degenerate cartilage, right? So think about that. The anabolic cartilage building cells called chondrocytes shift into a catabolic cell that breaks down cartilage. It doesn't not only not repair it, it actually actively breaks it down by upregulating things called MMPs, which are matrix metalloproteinases, which are a type of enzyme that can break down the joint, right? So what's happening here over time as you accumulate inflammation is you're getting degeneration of the subchondral bone, the vessels that supply blood to the bone and then diffuse blood into the joint space are collapsing and they're losing their compliance. So you're getting now an accumulation of inflammation in this region, and that inflammation accumulates in the synovium. Then you're bathing the chondrocytes and you're bathing the meniscus in inflammation. That bathing of these structures in inflammation switches the cartilage building cell from building into an active degenerative cell. This is why osteoarthritis and bone loss are all progressive conditions. They continue to get worse over time unless there's a specific intervention that occurs, right? So all of this stuff, the synovial inflammation, the loss of the chondrocytes, so they go into this bone degrading cartilage degrading version, the synovial hyperplasia, the abnormal angiogenesis, that is the generation of vessels, that starts to fall apart. So now you don't have the right vessels, the subchondral bone disruption that we talked about, and then the ligaments and tendons becoming unstable, again, because of the inflammation, right? And the inflammation eating away at those soft tissues and the cells that are changed by the inflammation eating away at the soft tissue. Now, all of that leads to joint pain and instability, which then can be diagnosed as rheumatoid arthritis. Now, it could, as osteoarthritis. Now, it could be rheumatoid. If it's rheumatoid, the differentiation is that there is an immune cell that's now gotten involved and actively degrading or damaging the joint. But the original process is still the same. It's just that in the rheumatoid switch, your immune system got involved and started attacking the joint as well, right? But the original pathology of everything we talked about the subchondral increase in inflammation, all of that stuff occurs the same way, right? So it's important to understand this, because what this is an example of is this is a quintessential example of a degenerative process that occurs in the body over time, especially when chronic low-grade elevation is high, chronic low-grade inflammation is elevated, right? And this is the same type of degenerative process that happens in the muscles, that happens in the brain, that happens in neurological tissue. So the same catabolic anabolic shift, and the anabolic going to the catabolic, the rebuilding going to the degenerating version of the cells, occurs throughout the body, right? You're feeling it in the joint more because the joint is load bearing, right? And the inflammatory mediators that set off this process are TNF alpha, interleukin 6, interleukin 1, interleukin 15, and 17 to a certain degree as well. But these are the key players here, right? And as it turns out, in cardiovascular health, in metabolic health, in neurological degeneration and all that, when you look at the main inflammatory mediators associated with those conditions, it's TNF alpha, IL-6, IL-1 beta, right? These are the three most prevalent and potent pro-inflammatory mediators. And they're the ones driving joint degeneration, right? So when you look at leaky gut and the types of elevation of markers, you see the exact same IL-6 being elevated. You see the same IL-1 beta and TNF alpha as well. All of those are elevated from leaky gut. right? And hence, individuals with GI problems are found to have 2 times the higher likelihood of having osteoarthritis, because if you have GI issues, you likely have leaky gut. If you have leaky gut, you've got an elevation of IL-6, TNF alpha, and IL-1. And as a result of that, you're going to accelerate degenerative processes in the joint, right? So all of these things are connected. And the thing is that the data I showed you, the 78 million or so Americans and the 50+% of Americans that have mobility issues with as a result of arthritis, those are all the symptomatic people, right? It's such a big percent of the population, and yet those are the symptomatic people. The thing is, the asymptomatic people are just as large, right? So this is a study. It's called the Framingham Joint Study. And what they did is they took something like 900 adults over the age of 50 who had no joint complaints or symptoms at all, right? So they felt perfectly fine. And then they did MRIs on all of them, on all of their major joints. And they found that 89% of adults have detectable knee abnormalities that are consistent with a degenerative process of osteoarthritis. And these are the asymptomatic individuals, right? So almost 90% of asymptomatic adults have joint degenerative processes going on in their joints. And then on top of that, 50+ million Americans, going up to 78 million Americans, already have symptomatic joint issues. So when you put those numbers together, we're talking about the vast majority of adults, right? We're talking about 85, 90+% of adults have some sort of degenerative process going on. Some are symptomatic, some are asymptomatic. And so we all have this anabolic catabolic battle going on within the system. You feel it in your joints. It may occur in the joints first before it occurs in other areas like your neurological system, your heart, your muscles, and so on. But it's the same exact process being driven by the same exact thing. This is why, to me, looking at joint health is so important, because, again, it's a canary in the coal mine for a bigger issue or bigger issues happening in the body, right? And this is a further problem for women, because when you look at women, as they're going into premenopause, perimenopause, and postmenopause, you see a significant increase in this menopausal transition of musculoskeletal pain, right? So the odds ratio, which is a way of looking at the percentage of people you'll find in a random sampling that would complain of this issue or has the issue, the odds ratio more than doubles here when you're looking at premenopause to perimenopause to postmenopause, when we're looking at musculoskeletal pain, right? So as women enter this really difficult transition in life, musculoskeletal pain increases quite dramatically. And that's in large part, to me, if you look at the mechanisms of action, when women go into pre and perimenopause, their guts become significantly leakier. And the reason that they become leakier is because they start to lose diversity, because they are losing the amount of estrogen that they're producing, right? And estrogen plays a role in managing diversity and stability in the gut. And so it completely connects the two. And then when you look at this data, when you look at radiographs, generalized osteoarthritis is 3 times more common in women aged 45 to 64 compared to men, right? So this is a compounding problem for women even more so than men. And it is an issue for adults in general. And we look at this hospital-based study, they showed a 10-to-1 female to male ratio for osteoarthritis at peaking at age 50, right? 10-to-1. That's unbelievable. So this is a real women's health crisis issue. And 64% of women with knee osteoarthritis experience symptom onset during this perimenopausal period, right? Or within 5 years of menopause or hysterectomy. And so if you're a woman in your 30s and you know that in the next decade, this is likely going to be a big problem, then I would absolutely be getting ahead of this potential problem at this point. If you're in your 40s, you may already be starting to experience the problem, or you're certainly in that window where the risk is really high. I would be very proactive about managing this issue. And if you're postmenopausal and you've had joint issues and all that, one of the things we've shown in our study is it's never too late to repair it. Right. So it's exciting. Keep it in mind that you can be preventative about it, or you can be proactive, or you can be reactive about it. Either way, you're going to be able to help yourself. But just keep in mind that these different phases play a different role. And the thing that really becomes scary about this is that the second biggest driver of disability worldwide is knee osteoarthritis, right? The risk of disability is really high. And we know that with disability comes, of course, significant metabolic dysfunction, significant risk for other things like cardiovascular issues and all that, dramatic mood alterations and quality of life, which of course makes complete sense, and a reduction in lifespan and health span, right? And so this is the second leading cause of disability worldwide. It's something that we should be paying attention to very, very carefully, right? Because we do not want this to create an issue. So what can we do about it, right? Let's talk about this impactful plant-based supplement that is standardized, that is novel, that has global patents that are applied for. It has 13 synergistic bioactives, things like xeritol, boswellic acid, bergaptan. And they all work together in concert. And we'll talk about exactly how they work in order to really improve what's happening within the joints and then metabolically and immunologically throughout the body as well. Right. So what we have here is Boswellia serratia. Many of you may have heard of Boswellia serratia already, but I can assure you that this is a very different version of it, and we'll talk about why. But Boswellia in general has been shown to be effective against pain and inflammation and swelling. It contains bioactives that are known to be LOX inhibitors. So LOX there's a type of enzyme called lipooxygenase that differentiates into pro-inflammatory mediators, right? And the active ingredients within Boswellia inhibit that metabolization or function of that enzyme. That's why it's called a LOX inhibitor, and that typically means an anti-inflammatory, and it's a natural, healthy version of anti-inflammatory. The proprietary extract is a standardized process, and we'll talk about what makes it special in this case. Apium graveolens is a celery seed. It's a very specific type of celery seed that's only grown in northern India. It is an anti-nociceptive, which means it manages pain, and it's a COX inhibitor. COX is the cousin to LOX. LOX is lipooxygenase, COX is a cyclooxygenase. Both are enzymes. Both come from something called arachidonic acid, and the active ingredients in the apium inhibit COX differentiation, so you don't get the pain signals getting amplified, right? And this is also a proprietary extraction and standardization process. So here's what makes these two ingredients so special and different from everything else in the market. Number one, and this side, this is the Boswellia. This is the celery, and this is the Boswellia on this left side. So when you look at the celery, the key ingredients are this apin, which is a precursor to epinogen, and then bergaptan, which is also really important, and cecilin, right? So it is this unique celery seed that has all three of these actives at clinically relevant amounts. And that's part of what makes it so effective in managing pain response in areas of high inflammation and degradation, right? So these actives are critical. And then on the Boswellia side, what's really important is xeritol. This is one of the key actives that we identified in Boswellia, and then we developed a process to be able to extract it, because we come to find out that xeritol has the ability to stimulate tissue regeneration. We first checked that out in the gastric system in people in an ulcer-induced model. This was an in vitro study. And so it wasn't in people, it was in a model of inducing gastric ulcers. And what we saw was that the xeritol that from our product was able to repair the gastric ulcers, right? So it can upregulate reparative mechanisms in the body. And then we've got all of these AKBAs, these are boswellic acids that are all really strong anti-inflammatory components. But then we also have this taurochilic acid. Taurochilic acid is really important because it works through a different mechanism to reduce inflammation. There's another receptor called TRVP. It works through that mechanism rather than the LOX mechanism, right? So we're getting a 1-2 punch on inflammation within the body, and then with the serotonin, we're upregulating some of the reparative signaling, and then with the celery seed extract, we're getting all of this really, really powerful pain management at the same time. They also have anti-inflammatory effects, so you're getting a little bit of both with the celery component to it. So let's look at some of the studies and the effects of taking this product, right? So the first one was in osteoarthritis patients. It was a 90-day study. So these are patients who have been diagnosed with and managed for osteoarthritis in hospitals and outpatient facilities. And these subjects were asked to come off their osteoarthritis medication. So most of them were on some sort of pain medication. They were asked to come off it prior to starting the study and then during the study as well. But the ethical boards don't let you keep patients off medication unless if they ask for it, right? So one really, really important aspect of the study is that we had rescue medication, which is a prescription drug for pain, very commonly used in osteoarthritis and other joint issues. And what the ethical board stipulated is when the patients came in for their visit, if they complained too much of pain, you'd have to put them back on their rescue medication, which is their prescription drug for pain, right? And I'll explain why that's important to note. And also look, this is a 1,236 patient study. That's a very large scale study for a supplement product, right? And it's published in the Journal of Orthopedics. And so here's what we see in terms of the effect in this very, very large scale study. We basically saw, and this is a WOMAC scale for pain. The WOMAC scale looks at pain, of course, but it also looks at mobility and stiffness and a couple other quality of life components. And so what we saw with the WOMAC scale was a nearly 75% reduction in pain, right? And stiffness and mobility and so on. So all of those are encompassed in here. And that is so significant because if you look here as well, so greater than 90% of the subjects in the study, that's greater than 90% of 1,236 subjects had over a percentage improvement, 30%, 34.9% of subjects had over 90% improvement in their pain. 25.8% of subjects had over 75% improve in their pain, which means that over half the subjects, 60% of the subjects in this study had 75% or greater improvement in their pain.
Okay, hold on. Wow. Yeah. I'm wowing. That's incredible.
That's incredible with 1,236 subjects. I mean, that's a big number, right? And these are patients who are osteoarthritic.
That is so hopeful. And also, this isn't like just a little, journal that I made in my backyard. Like, this is a big deal.
Totally, yeah. This is the International Journal of Orthopedic Sciences. And then here's the thing. So this is the WOMAC scale. The VAS scale is a different way of measuring pain improvement, right? So WOMAC and VAS are often used in both cases because they have just a slightly different perspective in how they review pain. But if they are congruent in their results, then you know for a fact, like that's very well established. And you then know that the pain improvement was very real and very significant. So then if you look here, so remember here, 35%, just to round up, of people experience greater than 90% improvement in pain. And remember, these are osteoarthritis patients that many of them have bone-on-bone rubbing, significant degeneration in the joints, and so on, right? More than 34.9%, 35% had more than 90% alleviation. In the VAS pain scale, 37% had more than 90% improvement. So very close to 35%. 27% or 27.9% had greater than 75% improvement in pain. Over here, 25.8%. So within a couple of percentage points, we're seeing the exact same distribution in the treatment effect of the product, right? In a large scale 1,236 subject study. So that is so exciting to see. And then, of course, this is a quality of life measurement. Quality of life dramatically improved over that same period of time, which, of course, if you're alleviating pain, allowing people to become more mobile, the quality of life is absolutely going to improve. And then one of the best parts about this is there was no adverse events reported, right? In a 1,236 patient study, no adverse events at all, which is really, really phenomenal to see. And then this was another study done by an independent group, and they were looking at the NSAID sparing effect of taking this combination, right? And this is almost a 400 subject study. So the reason they're looking at this is because remember we talked about earlier how osteoarthritis patients have 55% increased risk of cardiovascular disease. They also have increased risk of a number of other chronic conditions. Now, one of the attributable factors is the chronic use of NSAIDs by these patients, right? NSAIDs are non-steroidal anti-inflammatory products. So they are non-steroids. These are things like ibuprofen, right? And the problem with that use chronically is ibuprofen and most NSAIDs increase the risk of cardiovascular disease and other complications. And that's why you should use them sparingly, right? The issue here is that the majority of patients with osteoarthritis who are on prescription medications are still using NSAIDs in between the doses of their prescription medications, right? Which means that their use of NSAIDs are really high and chronic, and as a result of that, they have a significant risk of the side effects coming from NSAIDs, right? So this became a really important study, and what they found was, again, a pain score reduction of 75%, right? This was completely in line with the first large-scale study that was done by a completely different group, right? So this is a repeatable study that's now been repeated for the second time in a fairly sizable study population. This is done by a completely different group, right? Different principal investigators and so on. And then what they saw was a significant decline in NSAID use, right? It went from 70% of the study population using NSAIDs regularly to 32%. That's a huge drop in the percentage of people that are chronically on over-the-counter non-steroidal anti-inflammatories, right? And again, another really important finding, no adverse events in this group at all, right? Now we have almost 1,600 subjects in studies, no adverse events, about the same overall average reduction of 75% in pain. We're seeing, a doubling of the number of people that don't need NSAIDs anymore, and we're seeing significant improvement in the quality of life, right? And these are all managed osteoarthritis patients, right? These are people under active medical care and medical supervision, and they were still having such significant issues, right? So this was really, really promising to see. So this gave us the impetus to do the third study, which was not as big in terms of the size of the subjects, the number of the subjects, but we didn't need it because we already had two big studies. So what we want to do is go deeper. In this case, instead of going a mile wide and an inch deep, we wanted to go a mile deep and an inch wide on really understanding what is happening with this product in these patients, what explains the mechanism of action, and so on, right? So what we saw is that the control group saw no effect at all, and there was no significant change in any parameters. And yet the treatment group saw an increase in joint space. So remember your joint space, and I think that shows up here. This joint space is where the cartilage and the meniscus and all that is, right? As you get older and you have more degeneration and the cartilage starts to degenerate, what happens is you get a shrinking of this joint space. And you see in this individual, this is an actual participant from the study. This individual, the joint space here is so thin that in certain positions, they likely have this bone-on-bone rubbing, right? So they would be in a lot of pain and would have a lot of mobility issues. Now, in order to reverse these issues, what you really need is you need to see visually, and then of course you need all kinds of other evidence that you can increase the joint space. If you look at this same individual, look at how much space is now present in the joint, right? That is the cartilage rebuilding in that space. And the thing is, the prescription pain medications and all that don't do this, right? They barely manage the pain, let alone rebuilding the cartilage in there, right? And then again, reduced to 0% of the population reporting swelling, tenderness, and warmth in the affected joint. Significant decrease in the inflammatory markers. I'll show you that data. Significant increased cartilage regeneration markers. And there was no change in other biomarkers, safety biomarkers, and so on. A decrease in GI symptoms and no adverse event. What was interesting is many of the subjects reported a decrease in GI symptoms. And remember, osteoarthritis and GI issues go hand in hand. So the likelihood that many of these patients had GI issues was relatively high. And it was great to see the GI symptoms reducing as well. So all inflammatory biomarkers went down, all cartilage regeneration markers went up. But let me actually show you the markers. So remember those quintessential inflammatory mediators that are not only present in degenerative issues around the joint, but also degenerative issues in bone. They're also associated with cardiovascular issues. They're also associated with metabolic issues like obesity, diabetes, and so on. These inflammatory markers are associated and present in many of these conditions. So these ones, the key ones are IL-6, IL-1, TNF-alpha. Right? IL-7 is an issue. HSCRP is a global measurement of overall inflammatory processes. And ESR is the sedimentation rate, which when that's elevated, it tells you that your immune system is moving more towards autoimmune-like responses. Right? So with IL-6, you see almost a 67% reduction in that period, in the treatment period, 31% reduction in IL-1, 30% reduction in TNF-alpha, and then HSCRP coming down by 56% almost, and then sedimentation rate coming down by 45%. So if we didn't know that there was any knee issues or any other issues, and you just looked at this graph from the perspective of an individual, and if you asked any clinician, hey, is this a good sign for this individual? They would say, absolutely yes. Because this is exactly the type of inflammatory milieu we're trying to bring down, right? Because this is exactly the type of inflammatory distribution that causes issues within the individual, that is part of their chronic disease pathology and their chronic disease pathways, right? And so this in itself becomes a really important health marker for an individual. If all of you could go in and get your immunological test done and you can see a reduction or a healthy level, which is below zero, of all of these inflammatory markers, it's a really, really beneficial thing. And then you want to look at cartilage regeneration markers. This is something called P2ANP and P2CP. These increase by 46% and 45%. Right? Really, really significant, which means the active cartilage rebuilding going on in the joint. And then when you look at cartilage degeneration markers, right? These are things like CTX, SCTX, which is serum CTX, UCTX, which is urinary CTX, COMP, which is a activation associated with degeneration. It's a metabolic activity associated with degeneration. And then MMPs, which are matrix metalloproteinases, these are the enzymes that are released by cells in an active degenerative process, right? So we saw all of these going down between 20 and 41%. So degeneration going down by 20 to 40%, regeneration going up by 45 or 46%, and all of the relevant inflammatory markers coming down quite significantly. This is why we're seeing the joint being repaired, right? We're flipping the script here. We're shifting the winning catabolic process towards a anabolic process and rebuilding the space. Now, where the rubber really hits the road, the pain reduction is fantastic. We want to see that. The inflammation reduction through biomarkers, we want to see that. But where the rubber really hits the road for me is in the 6-minute walk test, right? Not only is the 6-minute walk test a validated marker of longevity and aging, it's also a great way of measuring your VO2 max and also a great indication of mobility, right? Mobility is one of the most important things when it comes to longevity and aging. And so here's what we saw. And this is a test basically where you have a flat, unobstructed path. You're not, going uphill, upstairs, any of that stuff. Just the ability to walk straight down the street for a 6-minute period, and you look at how much distance you have covered. Everyone can do this test themselves. I would encourage everyone to do this test. If you wear an Oura ring, Oura has a 6-minute walk test in the app. It's in the area that looks at your cardiovascular age. You can do a 6-minute walk test, and it's good to do it and maintain that. But this one, what we saw was the distance that was covered at day 0 was about the same between the intervention, which is the Cartigenix group, and the placebo group, within a few meters here, right? Now, after day 90, you see a 303 meter distance covered versus 193. No real difference in the placebo between day 0 and day 90. In the intervention group, however, a 57% increase in distance covered. That is more than double the amount of distance that these individuals are now covering, or close to double of what they're covering in that 90-day period. Right? This is the difference between being able to take your dog for a walk and not being able to do that at all, or walk down to the mailbox to get your mail, or go out and walk around the mall, get outside, being able to be mobile and do all of that. This is where the rubber really hits the road for this, right? So this was really, really exciting to see. So the overall outcomes of that clinical trial was within 15 days or so, a reduction in stiffness and an improvement in mobility within about 7 days, a reduction in the onset of pain. X-rays also reveal that there's an increased knee joint space within all the individuals by the end of the 90-day period. We see a significant reduction in all of these inflammatory cytokines, which is just great across the board anyway. We see a decrease in cartilage degeneration markers, an increase in cartilage regeneration markers. 100% of participants reduced GI symptoms. There's an increased distance in the 6-minute walk test. There's a reduction in fatigue in all of these individuals. And there was a long-lasting effect after stopping the treatment, because we stopped the treatment at 90 days and then we still followed them at 120 days and beyond. And everyone that was on the product, 90% of the people on the product, actually, to be specifically accurate, will all continue to report ongoing benefits even after stopping it after 90 days. So the only way that's happening is if we're actually repairing the joint, right? The cartilage is back, the meniscus is back, the soft tissue is back, the inflammation is reduced, and so on. Right. So that's the only reason you can have this lasting treatment. And we look at the clinical outcomes. This is, again, a repeat of that. And we would encourage you to see the results for yourself. Right. There's a number of ways you can test it. You could take your own pain scale survey. You can just Google a pain scale survey, take that, do the 6-minute walk test yourself. Even look at things like grip strength that may improve in that period of time. Look at your load bearing capability. Right? If you wear a weighted vest, see how fast you can go up a particular hill. If you're able to do that right now, and time yourself before the start to the finish, and just keep up with it, because you could test this and you can look at this all by yourself. And then we made the connection earlier about osteoarthritis being potentially a vascular disease. And as I mentioned, in the subchondral bone, it's all these microvessels that have to be compliant and functional in order to deliver and then diffuse blood and nutrients into the synovium, into the joint space, right? And so a decreased bone perfusion, which comes from these microvessels at the joint of the knee, and its physiological sequelae are associated with osteoarthritis, right? So we're starting to see that now, that the vascular component is really important. And as I mentioned, we're dealing with systemic aging, right? This constant battle between anabolic, rebuilding, and catabolic degenerative processes. And the thing is, as I mentioned before, this happens all throughout the body, right? You see it in the brain, the anabolic versus catabolic process. You see it in the heart. You see it in the lungs and the kidneys as well. You see it in the GI tract, in the joints, in the vascular system as well. So if the knees are losing the anabolic catabolic battle, you can be assured that it's likely happening in other parts of the body as well, that you simply won't feel for a long time until it becomes too late, right? So this is such an important thing. And the fact that we looked at the inflammatory cytokines, right? So these are the cytokines involved in all of the catabolic processes, right? And the fact that we measured these in serum, so it's in total circulation. We didn't go into the joint to measure it, and the fact that we could reduce all of those inflammatory cytokines and degenerative markers and all that seen in the serum means that we can help virtually every other system that gets the same blood supply, right? So this is really important. I think this product does so much more than just improving joint health, right? And remember that Framingham study showed 89% of asymptomatic people have cartilage degeneration. So if you're listening to this right now and you go, well, my joints feel fine, right? Nothing hurts really. I don't feel any pain. Well, joints are a proxy for the rest of the body, right? And they're a canary in the coal mine for issues. So you don't want to wait until your joints are showing symptoms, right? 89% of asymptomatic people. So you're probably in that 89, 90%, right? Not yet showing symptoms, but disease progression is present. So it's a massive opportunity to take early intervention and prevent it from ever happening, right? And our joints are surprisingly one of the only areas in the body where where a lot of health conscious people may wait for symptoms to show up before they do anything about it, right? We're not going to do that with our brain, with dementia. No one's going to say, all right, I'm going to do this very specific thing, which I know may help me with neurodegeneration, but I'm only going to do it when symptoms show up, right? We're not going to wait for the first early symptoms of dementia. We're not going to wait for early symptoms of cardiovascular issues or lung issues or, eye issues or dental or oral issues, right? Most people go to the dentist regularly. And so we don't want there to be issues. And when symptoms are present, that means issues have already started. And so there's no reason to wait to start really taking care of your joints, especially given 89% of people asymptomatic have progression of disease process already.
That's wild.
Right? So we'll end there. Should we jump to questions?
Yes. First of all, let's put some love into the chat. We'll open it up for to Kiran. Thank you, Kiran. That was amazing. Is that the first time you have done that presentation?
Of this version of it, yes.
Version of it, yeah. That is breaking news. Now, this is the thing. Some of the questions are coming in are like, I can't walk. Is it going to help me? So no, it's not going to help you if you are like in a wheelchair. All right. I'm just going to say like, let's all, sort of like reel it in and know that you have, first of all, it may help you if you're in a wheelchair, but I don't know. You get the idea though. Like if you're on life support and they're like pulling the plugs, this is, we're not talking about that. What we're talking about is really ultimately food, right? Yeah. These are incredible herbs to help your joints and your overall body. You just talked about that. Let me ask you a couple of questions. Is it that it's helping the regrowth all through the body, or is it just the knees? People are asking about their ankles, that kind of thing.
Yeah. So we studied the knees because they're one of the more prevalent areas to be able to study. Yeah. But no, I mean, there's no reason to think that it's not upregulating the regeneration process throughout the body. So the cartilage markers, the degeneration and regeneration markers, all the inflammatory markers were all measured in serum, not in the joint. So these
Okay.
are global markers, right? And so we know that those cartilage markers that we measured in serum are associated with with the knee joint, just because we can visually see the knee increasing in cartilage levels. But it doesn't mean it's not fixing cartilage in other parts of the body as well,
Of course. It's
right?
just
And
that's what you studied.
it's what we studied because we could really hone in on it and measure it and do that. So yeah, I mean, given that our markers that we looked at were systemic markers, there's no reason to think we're not seeing systemic benefits here.
So we do have a special for you, and this I'm going to start out with something that I don't usually start out with, which is the 90-day money back guarantee.
Mm-hmm.
So that's huge. So they're so confident in the research that they're able to do that. And if you go to the link, which I've put into the chat, which I'm not going to spend time like reposting because it's in there, you'll see you can get 1 bottle, 2 bottles, 3 bottles. It keeps getting a better discount as you get more bottles. And also, if you get auto ship, there's an additional 5% off. So you can have up to 30% off.
Mm-hmm.
And do me a favor, as soon as you get it at home, use it, try it. They're saying from the studies, 15 days to 90 days, people start to really notice a difference. So that's fairly fast. And
Yeah.
we do other things and we're like, hey, in 4 months, then this, but that's really quite fast. So,
Yes.
so think about that. Okay. Everybody, we're going to the Q&A box. If you have questions, pop them into the Q&A. Hey, Robin. Okay, can GI issues like IBS or SIBO cause osteoporosis? Speaking of the gut.
Osteoporosis, yeah. So osteoporosis also is driven by inflammation. Remember, I talked about this process actually starts in the subchondral bone. That is a process of osteoporosis. And it's inflammation that starts that process. This is another reason why, in addition to estrogen stopping bone resorption, women as they enter perimenopause have more chronic low-grade inflammation as a result of gut dysfunction, which is why osteoporosis also increases in women at that stage, right? So,
and
yeah.
by the way, they're just getting started. Like how new is this company? You guys just started. So like the research is in and it was in such a great publication, but like I'm sure you're planning more. Some people are like, can you tell if it's going to improve my DEXA scan? Which is a great question, but get it, try it, see what you all think. This is seriously, you all are early adopters. Is basically what's happening right now. You are on the cutting edge. Okay. Yeah. Dara, are there any ingredients contraindicated if you bleed easily?
No, none of these ingredients impact what you call PT-INR, the prothrombin time, which is the component that's important for bleeding people. So there's no reason to think it impacts that.
Okay. So we've been talking about the joints. Now, how do you think it's going to, and I'm sure you're going to do a study at some point on this, about bone density?
Yeah.
Which is really what you talked about, but like just pulling those words in.
Yeah, we know that we're improving the function of osteoblastic cells, which are the bone building cells. But I think bone density is probably a secondary effect of this product. So we don't really label it or push it too much as a bone health product, although I think it's going to be very supportive for bone, but we likely won't do a bone density study for that. There's a different technology that we're working on right now that's very specific to bones and bone density, especially. This one is much more functional in the joint area and soft tissue, cartilage, and other soft tissue regeneration.
Okay. Dosage used in the study.
Same dosage is on the bottle. So that's the 550 milligram twice a day, right? So in this case, it's 2 capsules a day. So it's 1 capsule twice a day.
Yeah.
I saw a question pop up about in the study, the product is called Celeract, right? I think someone mentioned that. And it's the same thing. So Celeract is the brand name that we use in India. In India, it's sold as it's like a functional food almost. It's like a prescription food product, which is a little bit above a dietary supplement, which doesn't require a prescription. So this is more like a medical food in India. And the brand that it's sold under is called Celeract. Obviously, in our partnership with Calroy here in the U.S., we are under the Calroy label of Cartigenix. So it's the same exact product.
Okay. There is a money back guarantee. I just want to confirm that it's 90 days. Yeah, it's 90 day. 90 day, because somebody just in the chat said it was 45 days. So I'm saying 90 days because that's what I heard from the team. Okay. Any histamine concerns or issues?
Not at all, no.
Okay.
Especially with the reduction of CRP. I mean,
Yeah.
it is an anti-inflammatory, so yeah.
Okay. Can it be delivered to Canada?
I believe that registration is going on right now. There's an NPN number in place or in process. I would guess in the process started about 3 months ago. So my guess, and somebody on the Calroy team might know better, but my guess
Okay.
is probably by the end of the year they might be in a good place
Okay,
with
so
it.
not yet. They're working on it.
Mhm.
Yeah. So Julie, they're working on it. Sorry about that. Do you have to take it forever until your symptoms go away? So he was saying in the study, after 90 days, people still notice the improvement. Guys,
Yeah.
everybody is different. So
Mhm.
this is the thing. Like if you have bone on bone and you're taking it, and then I only have a little bit, it's there's so many factors. So
Yeah.
I know we're all looking for that magic bullet, but I just need to like just soften the edges here just a little bit. We don't want to lose the
Yeah.
plot. This is food to support ourselves, food that has been studied to show phenomenal, really amazing results for the over 1,000 people and put into the orthopedic journal. So cool, very cool. Okay, here we go. Oh my gosh, so many questions. I love you people. Okay, any concerns about kidney disease stage 4? I'm so sorry that you're going through that.
Um, I mean, we
Talk to
don't
your
have
doctor, of
any reason to
course.
have concerns, but I would absolutely talk to your doctor about it.
Mm-hmm.
Kidney disease is complicated with herbal products, so yeah, I would talk to your doctor about it.
So Calroy's the company, and they're saying the normal money back guarantee is 45 days, but for this, because of the studies, it's 90 days. So don't reach out to them in 120 days and go, hey, do it, be respectful and do it within the window. Okay, but I want you to just take it and get your own results. Okay. Let's see. La 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 la. Okay, will he comment on the TBS score being very degraded with a DEXA OA confirmed? So osteoarthritis confirmed. So quality of bone is like sheetrock. Joint is bone on bone. I'm so sorry. Can this help get circulation in there?
So I would use this in conjunction with the arteriosil, which is the vascular health product from Calroy, and
Oh,
the Vascanox, which is the nitric oxide. So the nitric oxide and the arteriosil are really important for improving vascular health and vascular compliance. So then all of those little microvessels start to wake up and start to become more compliant and be able to carry blood better. So those two will really help while this is trying to repair the actual inflammatory damage that occurs in the joint space.
okay. Hold on. I got something here from Lisa. Hey, Lisa. She's a PT. Years ago, they looked at stem cell use to grow new cartilage, but adult joint loads were too great for new growth. Hopefully,
Yeah.
hopefully the technologies move forward. Years ago. Does the viscosity of the synovial fluid change with this method that may contribute to the joint space on exam? Thank you for asking your question in such a respectful way.
Yeah, it should. The viscosity should improve, and you actually should improve the lubricant effect of the synovium, of the synovial fluid. And what a note on stem cells, right? So stem cells, for them to work, they have to differentiate, be able to differentiate into the target cell. In this case, maybe cartilage, or maybe chondrocytes that you're trying to get the stem cells to differentiate into. The thing that's really clear about stem cells is they don't differentiate effectively when there's a large milieu of inflammation, right? So in a degenerative joint, you've got a lot of inflammation. So if you put stem cells in that region, they're not necessarily going to differentiate into the target cells. They're probably going to just remain as stem cells and become senescent, which also happens to the chondrocytes in that space, meaning they become zombie cells, if you will. And so I think we don't have data to support this, but I would hypothesize that using this for a few months and then doing stem cell therapy may actually enhance the effect of the stem cell therapy, right? Because we're bringing down that inflammation.
So interesting. Okay. Any contraindications? I think we've kind of covered that. I've already been taking the product for 3 months. My right knee no longer makes me have weird crunching sounds when I go up and down the stairs. Hi, Pat. That's fantastic news. How long should I
That's
continue to
awesome.
take this supplement?
I would say it depends on your level of activity. So if you're getting more active now, you're walking 10, 12, 15,000 steps a day, you're starting to do stair work and things like that. Those are really, really good for you, right? Mobility and activity and all that is really critical to longevity and really good for you, but they do then put more stress on your joints. And clearly, if you've had joint issues in the past, your body had this tendency to be degenerative. Now you're winning that anabolic catabolic battle. So I would stay on it to continue to propagate the anabolic process, especially as you gain more mobility and you want to get around more and you want to put more stress on the joint. I think that's fine. Just maintain that anabolic state. So in your case, I would encourage you to stay on it.
Okay. That's phenomenal. Okay. I have a client who's waiting for hip replacement and really in pain, having very tough time walking even a small distance. Hey, Robin.
Mm-hmm.
I mean, based on the research, it sounds like it could help.
Mm-hmm. Yeah, I mean, a lot of people get hip replacement surgery because of the soft tissue degeneration that occurs in the hips, right? And again, this thing helps with soft tissue. We don't have data on hips, so I can't reference any
Right.
data there specifically. But from looking at it from a mechanism perspective, there's no reason to think it wouldn't help hips, right?
Okay.
Now, is it going to prevent them from getting surgery? We can't say that. We
Of
don't
course
know.
not. Right.
But certainly it may make them more comfortable and more functional prior to that.
Right. Okay, guys. They're okay. I have to like we are way over, but I really want to so Aline is asking a good question. I want to get as many as possible. So do you think that it helps with leaky gut, Kiran?
So our studies on the serotyl component of boswellia shows that it rebuilds the mucosal lining in the gastric system. We looked at it in the stomach. Now, the mucosal lining in the stomach and the small intestine are not dissimilar at all. So I would venture to say that yes, it probably does. Now, remember, in every one of the large scale studies, the people had reported an improvement in GI symptoms, right? And that could be a number of reasons. It could be because they're taking less NSAIDs. It could be because, they're moving more and they're overall getting healthier, their quality of life's better and all of that stuff. But I think it does. I think it has a measurable effect on the structure of the lining of the gut, right?
Okay.
So I think it's a great add-on to any GI protocol.
Any concerns if you have autoimmune disease?
No, not at all. With
Okay.
ESR going down, so ESR, which is a sedimentation rate, it's a erythrocyte sedimentation rate. That's a kind of a global immunological test to look at someone's propensity to move towards autoimmunity. If the ESR is really high, that means there's a likelihood that there may be some sort of autoimmunity going on in the individual. So seeing that ESR has dropped so significantly in the subjects, I think it's actually helping the immune system, kind of fight against that autoimmune push. And
Okay.
so, which means that things like Tregs, regulatory T cells that kind of dampen autoimmune responses, those may be elevating and protecting the system more.
How does it compare to a peptide like BPC 157?
So BPC is really interesting. It has reparative qualities, but there's zero studies in humans.
Mm.
There's a lot of mechanistic studies in animals, and I know a lot of doctors that use it, and they get really good results by it. But there's no studies in osteoarthritis. There's no studies in joints. I think it would be a good combination. And I don't see any harm in BPC, but I don't think it'd be a replacement for it.
So when you guys are asking me about like different body parts, you have to remember they did the study on knees. He's talked about like the other things, and everybody gets the 90-day return policy. So here's what I suggest. Try it. And on day 80, start to really evaluate whether or not it's been helping you, and
Yep.
then make a plan if you are thinking about returning it. But to start taking it as soon as you get it, because that 90 days starts when you receive it. So there are a lot of companies that do not do return policies. And I don't usually go down this rabbit hole about like the return policy, but this is based on like the research, and everybody is different. So I need you to kind of like go, I got to try something again. Have that resilience, have that enthusiasm for like really understanding that everything you're doing is not a fail. It is get so many no's till you get the yes. You are going through your process until you get there. And I'm so excited about this. I'm absolutely thrilled. I'm thrilled and I'm honored to be bringing this to you. I don't think Kiran's done any other webinars for anybody else. I think he's doing this at like conferences and stuff. So it's like a big deal. So you can really, really, okay, that's it. Very excited. Mary's excited. Yay. Okay. So we don't really see any probiotic, beta glucans, butyrate interaction, like all the other stuff you're doing. You don't really see a problem with that. Spore biotics for gut strep, right? Yay or nay? You know, he did co-found Microbiome Labs, the creator of Megaspore. So we're going with a yes on that one.
For sure.
That is a yes. And we answered that live. And then, hey, Marty. Oh, Marty has osteoporosis and needs a tooth implant. Would this be helpful? Sounds like it's worth a try. It's interesting for dental. Oh,
yeah, for dental, it could be very interesting. I mean, again, you know, the same inflammatory mediators play a role in bone degeneration. So it's not a leap to think that it would be beneficial there. We don't have data to speak to it, but it's not a leap.
So he didn't do it just on Boswellia. He did it on, the study was on the multiple ingredients.
The combination is really important. There's a significant synergy between the combination, which is why we've filed global patents on the combination of it, because the combination does things that have not been shown for Boswellia or celery.
And this is not the same as celery juice. So let's talk about the celery thing, because it's the celery seed that's different.
It's the celery seed that's different. And then within the seed, it's a very specific flavonoid extract that has to be concentrated. It's a complex and complicated process because it's like a gum extract that's really difficult to work with. So you're not going to get the same effects from celery juice. Celery juice has other benefits and great if you're using it. You're also not going to get the same effects from any other celery seed product on the market or Boswellia product on the market. Because remember, we made discoveries of these new actives and we had to develop all new systems of extraction to be able to pull those new actives out as well. Hence, again, the patents between the actives and the functionality and the synergy. That's where the global patents come in.
Guys, everybody, there are like 5 people asking, do I have to keep taking it? Okay, here's my thing. It's food. It's herbs. Herbs are medicine, so it can be very powerful. If it's helping me, I'm taking it for a long time. Can you pulse it? Sure, try it. You have to make this your own. So I'm going to get off of that bandwagon, but I'm going to also like edit out the things that are like, you don't come from fear, my loves. Do not come from fear. Come from power. You are empowered here. You have made your own luck by showing up for this. Getting darn discount. Love that part. You got the 90-day money back guarantee. This is cool. This is so exciting. CJ, I'm not saying it's not money. You know, I always very much honor and I will never mess with your paycheck, but I also like to give you a discount wherever I can. But if, just like weigh it all out there and think about this. Okay. Think about what if it does work? That's the exciting part. Okay. After a certain older age, do the ingredients in this product still get an older body to help build the cartilage up? Perhaps certain preconditions, etc. Like it doesn't, if someone is older, do you think that will impair the results?
Not that we've seen in our study. We had, I think the study age group went up to 80. And the thing is, your body always has the ability to regenerate and repair, right? As long as you're alive, you're not 100% degenerating. You are repairing things.
Yeah, right.
Right? I mean, you just think about your hair continues to grow, your nails continue to grow, your skin still changes. All of that are anabolic processes in your system. And so you do still have anabolic capability. It's just the catabolic capability is way more accelerated. And so we're just trying to bring that balance back. So yes, absolutely. you can improve and regrow and rebuild even at an advanced age.
Nan, is it too late? No, I don't think it's ever too late, but try. That's the whole thing. This is all I'm trying to get you to do is to just try. Just try it, see what you think. There is no downside. Let's see. If you've already had knee replacement, take this to avoid, like, this is what I'm talking about. I cannot say we're going to avoid revision surgery for you for a new replacement, Joe. I love you and I hope you feel better. And I think you should give it a try. Okay. Let's see. Are the ingredients organic and third-party tested?
Yes, always. So organic, they're all grown organic. The beauty of this is, so one of our deals, right? So the collaboration here is between one of my companies called Phytoveda and Calroy. Phytoveda is focused on taking known herbs that are grown in India and then adding all new science to it to make new discoveries and doing more research to it. A very important aspect of what we do is having really good, equitable contracts with the farmers. Right? Because many of these farmers have been abused for decades by having to grow GMO cotton and all kinds of nonsense that doesn't give them any yield, and they lose a lot of money. And in fact, the suicide rates among farmers in India is one of the highest in the world of any profession, because of that issue of losing basically their land and their farm. And so we contract them to grow these really high value herbs. And we contract out a certain amount of farm land and then we guarantee them a certain amount of payment so that even if for some reason something happens, is an insane monsoon or something, and the yield of the crop is bad, they still get paid really well for their effort, right? Yeah. And because we control how they grow, we also control what's used in the soil and all of that. So we don't allow all of the crazy commercial pesticides and all that. We haven't had the USDA come and do an organic certification. I don't think we ever will. It's really not worth the process. But it's all grown by traditional methods and then harvested by very traditional methods because we don't want any contamination on the plants. And then from when it's harvested, then it goes into our specific control after that. Right. Okay. So, and then of course, to release any product on the market, you have to have third-party testing. So that's third-party labs doing all the contamination, safety, and all the other testing.
Okay. Okay. By the way, I always forget to do this. Sorry. Okay. John's asking a really interesting question. Any risk of feeding cancer since regrowth is increased?
No, so this is through a different mechanism, right? So cancer cell growth is through an mTOR mechanism. And what that's doing is it's negating a natural process in cells called apoptosis. Apoptosis is programmed cell death. Right. So your cells are smart enough to know that when something's wrong with them, like their DNA is misfolding and so on, the cell undergoes programmed cell death. When you have high levels of mTOR, which is a genome expression, you negate some of that apoptosis, which can then allow the cells to continue to grow even when they're dysfunctional. So it's a very, very different mechanism and component of cellular growth and generation. Right. This one is like chondrocytes, which are, hey, we are responsible for building collagen. Oh, we stop building collagen. In fact, we're going to break down collagen because of the inflammatory signals around us. When those inflammatory signals are alleviated, they go, let's go back to building collagen now. So they start laying down collagen again.
Okay. I didn't know Calroy had a microbiome gum. Do you have a microbiome gum at Calroy?
I think it's an oral microbiome gum, right? Yeah, it's for the oral cavity.
Yes, yes, that is what I meant. Right. Yeah. Because that would be also very interesting. But no, this is, are there synergistic effects with the Calroy oral microbiome gum? Yes.
Yeah, of course. Yeah. Oral health, oral microbiome health is synonymous with gut microbiome health. And then gut microbiome health is synonymous with inflammation, and it all's connected, right? So
all one big tube. Tubes within tubes. Any issue with celery and oxalate issues?
No, there's zero oxalates in this. This is a very highly purified extract, so we're not pulling any oxalates in with this product.
Okay. Okay, great. Let's see. People wanting to be in your hip study. Caroline, can it be used in dogs?
Yeah, so actually, the active ingredient, the celery seed ingredient, was originally developed for large breed animals and dogs.
Yes.
And then it just was the effect was so profound. And this was like 15 years ago. Well, we actually started working on this technology that long ago. We then did the spores and the gut stuff, so we kind of backburnered it, and then we revisited it about 4 years ago to revamp the development of it. But the original work was in animals. We have a couple thousand pages worth of studies in dogs. So it works amazingly well in dogs. My little 17-year-old little old lady, she takes it. She walks a mile and a half each day. So she's doing well.
Oh, that's amazing. Okay. Well, Petunia's here in my ear. She wants to know what about cats?
We haven't done studies in cats, but I don't have any reason to think it wouldn't work with cats. I don't know if it's going to help their attitude,
I
but
don't know. A catitude. Do
yeah,
a little research because not everything that works for dogs works for cats. And,
yeah.
we're very careful about all that. Okay. Any studies on just Boswellia?
On our Boswellia, yes, we've done a couple of studies on the gut side and on the inflammation side, and it works amazingly well for that. It's the combination that really works synergistically to get the effects that we're seeing. So, and keep in mind, if you take conventional Boswellia, you will get an anti-inflammatory effect, no doubt about that, but you're not going to get the regenerative, the actual joint repair that we're seeing with this combination.
Guys, grapes are fatal to dogs. I did not know that. I did
No,
not
yeah, they
know
are.
that. Well, because I'm just a new dog owner, so or she owns me, whatever. So I just, regarding the cats, let's just like do a lot of research around the ingredients. Christina, okay, take care. Thanks for being here. Petunia is upstairs. She is not having it, although they are getting closer. But I mean, like, she used to sit on my desk, which was like a dream come true. And I'm trying to get her on the desk and Sadie on the ottoman, and then I will be totally, I will be like
Zen.
Zen. Mission accomplished. Okay. So will it help with osteoporosis or osteopenia to help prevent or help reverse either to any extent? So Diane, like, I really want you to go back and listen to some of the research that he was talking about, and so you can extrapolate it for yourself. You can't really make that claim right now.
Yeah.
So it sounds like it's a good idea to me personally, not a doctor. Okay, what would be the dosing if I used it for my 90-pound dog? Hey, nurse Mika.
Yeah, I mean, one cap a day would be plenty for dogs. Most of the studies that we did around dogs were in that 200 to 300 milligram range for the total
Okay.
mix. So I think one cap a day would be plenty. Just open it up and mix it in food.
Okay. Okay, let's see here. I haven't even finished reading this, but here we go. Asking the question because conventional and even integrative physicians probably won't take the time to research the product and going into the literature to know if my body can take it. I'm glad you're here. You have come to know better with so many patients taking the product, some of which are on certain bone medications, which are he can't answer which bone medications are problematic and which ones aren't, but you know who can is Margie Bissinger. I would go look her up and see what she has to say because she has a lot of opinions about that and has done that deep dive.
Yeah, and actually, I want to reference a place. I just learned about it. They contacted me, and it's phenomenal. It's called Effica Safe. And it's a website where you can go and type in the herb and the drug you're taking,
Right.
and it'll give you all details about herb drug interactions.
Oh, that's great. How do you spell it?
I think it's EFFICA, Effica, SAFE.
Just guessing, but that's a cool site. That's
Super
great.
cool. It's AI driven. It's really detailed. And what's cool about it, not only does it alert you if there's any contraindications, but it also alerts you if there's any synergies that could be beneficial. So I would go and type that in.
Somebody was telling me if you do red yeast,
rice,
yeah, you have to do it with something else too.
With a drug, you mean?
I don't know. She was just like, if you do it, try it with this. And then she ran away. So I don't know. I'll go look at this as well. Okay. We are going to wrap it up. Can you open the capsule? Great question.
Yeah, you
Yeah.
can.
Yeah.
Yeah, it's going to taste a little astringent. It's not, if you want to mix it in yogurt and things, it's probably not going to taste great. But you can open the capsule. It's not an issue.
Okay. Okay. Um, so there's no discount code for you to fill in for the 1 to 3 bottles. It is already populated. If you go to my page, it will be right there. So it's not on the oral gum microbiome. It is on this product. This whole webinar was about this. But I really appreciate you all coming. I really appreciate you all doing your own due diligence and research and trusting me to bring you great information. I'm very picky, as everyone knows. And of course, thank you to Kiran and the team for giving us such phenomenal information and research and doing the work, man. Thank you so much.
You are welcome. Thank you. It's been a pleasure. And I was so excited to be able to bring it to you and your audience. So I'm so glad we got to do this.
Me too. Me too. With a discount. Thank you.
With a discount.
That means so much to us. It really does. All right, Kiran, I know I kept you longer. Love you. I'll talk to you later.
Thank you, everyone.
Okay.
Bye.
Bye-bye. Thanks, everybody. Really appreciate you being here. I'm sorry we couldn't get to every question, but dig into the research, re-listen to the replay. And then I think, look, his talks are very, very intense with science. And so I understand why, like, for me, sometimes I play it on slow when I hear the replay, or sometimes I just like stare at the slide, and it takes a lot, like, okay, this is what he also meant. So, I like Dr. Alison Seebecker says, and what I call it is sacred repetition. So go in there and listen to it again and absorb the information, give it a try. We've talked a lot about how there's really no risk. And I'm glad you liked it, Dara. Yeah, great to have you all. Thank you all so much. Anyway, you get the idea. I don't want to repeat myself. I will see you next time, though. We have some really great things coming down the pike. Okay, lots of love. Thanks, everybody.